Hello, my name is Hillary McNary, and I am presenting a career profile on childbirth health educators. Childbirth educators often work in public clinics, health departments, hospitals, community centers, birthing centers, physician groups, or even out of their own homes. They are commonly employed by community health service providers, hospitals, practitioner clinics, religious organizations, or government healthcare departments. Self-employment is also a viable option, which many people in this field will take after a significant amount of work in the childbirth field and experience with teaching the subject. The majority of a childbirth educator's time is spent in researching, preparing lesson materials, and most prominently in instruction sessions with the clients. They can work either on a full-time Monday to Friday 9 to 5 basis or part-time, which usually constitutes evenings and weekends, as those are the hours most commonly available to their clients who may have daytime jobs. Typical stressors that come with this job can include the amount of time spent researching current evidence-based care, local policies of care providers, hospitals, and birthing clinics, writing and updating their teaching curriculum, and preparing their lesson materials, which can include pamphlets, booklets, worksheets, handouts, and such. This research and preparation time may require long hours at a desk. It's not an especially demanding job physically. However, there are certain tasks such as demonstrating relaxation techniques, birthing positions, and the use of certain tools such as a birthing ball, which may require a degree of physical flexibility and stability in order to carry out. And the clients that come to you can often be dealing with a level of anxiety, either due to being first-time parents with no experience and a fear of the unknown, or due to being experienced parents who have had past difficult or even traumatic birth experiences. Many people will come to these classes with preconceived notions and beliefs about a medical process that is filled with a high level of variability and uncertainty. An additional stressor for those who are self-employed can be that income may be inconsistent due to the ebb and flow of seasons. More babies are simply born during certain months of the year, which can cause some peaks and valleys in the workload. Common tasks that are required with this job are maintaining extensive knowledge, which you can then impart about reproductive health, women's health, pregnancy, childbirth, the postpartum phase, breastfeeding, infant development, and infant care, particularly newborn care. These instructors hold group or individual teaching sessions and conduct seminars, sometimes Q&A sessions, depending on how they have designed their courses. They provide information about common maternal and fetal health care practices, maternal care options, birth plans, different philosophies about giving birth, natural versus doctor-led sort of things. They demonstrate labor and delivery coping strategies, breathing techniques, pain management techniques. Sometimes these are based on specific programs or philosophies, such as Lamaze, the Bradley method, hypnobirthing, and so on. They address health concerns and complications that arise in pregnancy and childbirth, answer questions about those sorts of concerns, and provide resources for treatment. They teach expectant parents about their legal rights in the labor and birthing process. And they research evidence-based and most up-to-date recommendations, as well as labor and delivery technology. And they, as mentioned before, are sometimes required to create their own lesson plans and resource materials. If they are self-employed, the job will also require competency in all the skills needed to operate a business. This includes marketing, advertising, bookkeeping, tax preparation, and covering operational costs, perhaps building rentals, buying the supplies needed for in-class demonstrations, as well as buying the teaching materials, lesson manuals, pamphlets, worksheets, workbooks, handouts, and things like that they provide for their clients. This job requires a 4-year bachelor's degree. No specific field is required, but nursing or health education backgrounds are preferred. Courses in education, child welfare, health and wellness, pediatrics, biological sciences, women's health, and other related subjects are extremely beneficial. Experience as a registered nurse in maternal fetal medicine will greatly increase employability. In fact, some hospitals, rather than hiring a childbirth educator, they will recruit labor and delivery nurses who have a great deal of experience and are competent teachers to lead their childbirth classes that they provide in hospital. Training and experience as a midwife or a birth doula are similarly beneficial, but again, not required. Some employers do require the Certified Health Education Specialist credential, which does require ongoing education in order to maintain certification. It is highly recommended and frequently required by employers to receive certification from an institution such as the Academy of Certified Childbirth Educators, the International Childbirth Education Association, the Prepared Childbirth Educators, Inc., or Childbirth and Postpartum Professional Association. The median income for full-time childbirth educators falls around $62,000 per year. The typical range runs between the mid-50s to mid-70,000 range, depending on the level of education, certifications, experience, geographic location, and so on. Part-time educators' average hourly rate is about $28 per hour, and self-employed educators usually begin around $35 per hour with unlimited earning potential due to the nature of self-employment. Additional valuable skills for this job include the ability to teach adults with a wide variety of backgrounds, education levels, and learning styles, and doing so effectively, clearly, and engagingly. Communication and writing skills can be important for those who prepare their own lesson outlines and reading materials for the clients. Interpersonal skills are extremely important. Compassion, listening, sensitivity, maintaining an assuring, knowledgeable demeanor help to foster trust and can help with navigating issues that can be extremely emotional for clients. Time management is also a very important skill, says the woman who has stretched this 5-minute presentation into 9 minutes. It's important to be able to start and end lessons on time and keep the group discussion on task and moving forward in a timely manner in order to cover all of the material in the allotted time available. Public health careers, including childbirth educators, are considered quite secure. They have a steady growth rate projected to continue at about 20% over the next 10 years. the salary range is competitive. And after gaining experience, this job may offer opportunities for promotion into a management position. Or with a master's degree in health education, there is potential to become a health education instructor at the college or university level. That's all I have today. Thank you so much for your time, and it's been a pleasure.